All right, you're watching Fever FM and this is RJ Neel. And let me tell you that these days stroke is a major global public health problem. In fact, in India, stroke is increasing and becoming the main reason for premature deaths and disability. Now, as per World Stroke Organization, 1 out of every 4 people has a chance of suffering a stroke in their lifetime. And that's not all. In our country, around 1.8 million people suffer a stroke. A very few manage to reach a hospital in time, and that's something really very serious. And that's the reason we have invited our guest today. And our guest for today is Dr. Sukalyan Purkayastha, Head Neuro Intervention and Endovascular Surgery at Institute of Neurosciences, Kolkata. Doctor, welcome to Fever Akshachar FM.
Thank you. Thank you.
Now, doctor, as we are talking about stroke, now the first question that I'd like to ask you is, what is brain stroke and how severe is the disease? Like we get to know about brain stroke a lot. We get to hear about brain stroke. A lot of people suffer from that. A lot of our near and dear ones have also suffered, I'm sure. Now, what is this brain stroke and how severe is the disease? That's my first question to you.
Okay. So, as you have rightly told about the statistics of the strokes, and that is quite disturbing. So, let us talk about what is brain stroke. Before going to brain stroke, I must tell you the brain is an amazing structure, and it guides all the thought process and putting those thought process into action. So it is constantly working, even when we are sleeping, even when we are not doing anything, it is working. So it requires constant supply of oxygen and blood glucose for it to work constantly. And who supplies that? It is the blood flow. Okay? So it is the blood flowing to the brain, it supplies oxygen and the glucose for its to work. And when this there is a shortfall of oxygen and glucose, the signs and symptoms of stroke happens. So that is the basic pathology of stroke. And why it happens, how it happens, there can be a block into the supplying artery. There can be a tiny clot formation inside the artery, which blocks the blood flow to a particular area of the brain, and we get a stroke. So this particular type of stroke that happens in this way, we call it an ischemic stroke. Ischemia means lack of blood supply. Another type of stroke happens when there is a rupture of the blood vessel and there is accumulation of blood clot in the brain tissue, and we call it hemorrhagic stroke. So these are the two types of stroke. And for the common people, sometimes they call the stroke means heart attack. This is not heart attack. Stroke is brain attack. And these are the two types of strokes. Now, out of these two types, the ischemic stroke, the first what I mentioned, it causes around 85% of the total amount of stroke. So we are really concerned about the ischemic stroke. In most of the cases, when the patient suffers stroke, we think and we get to see all the signs and symptoms of ischemic stroke.
Now, if we talk about the symptoms, because any disease or any problems has its own symptoms. Now, when we're talking about stroke also, I'm sure it must be having some symptoms of its own. So what are the symptoms of stroke and how to recognize if someone has a stroke?
So when a person suffers a stroke, so let us concentrate on the ischemic stroke, because that is the 85% as I told you. So when an artery gets blocked, immediately the brain tissue suffers ischemia. And until unless it is treated, each minute around 2 million brain cells can die. So that is very important for us to understand. And when the brain tissue is at risk, the patient suffers symptoms. And we should remember the term FAST, F-A-S-T, as far as the stroke is concerned, acute stroke is concerned. F means the drooling of one side of face. A means either arm or leg weakness of one side of body. S means speech. There is a problem in speech. Either the person is not able to speak or he is having some slurring of speech. So that is the S. And the T is to denote the time. That means you should not waste any time. If you are having these symptoms of these three symptoms, you should not waste any time and you should rush to the nearest hospital, because these are the signs and symptoms of acute stroke. Now, there can be some other symptoms of stroke, like vertigo, okay, reeling of head. Sometimes it can be nausea, it can be double vision, or it can be difficult to walk, depending on the site of the involvement of the stroke. But basically, it is the arm weakness, difficulty to speak, and drooling of one side face. So these are the three symptoms everyone should be aware. And if you see this sort of symptom, there is no point wasting time. We should rush to the hospital, and that's how this fast tells us.
You're absolutely right. If we get to witness these symptoms, we have to rush to the hospitals. But otherwise, how these strokes can be prevented?
Yeah. So we all of us, we know prevention is better than cure.
Anytime.
So the stroke, yeah. So it should be prevented as far as we can. And the first thing what I'd say is the lifestyle modification. That means all of us are now having more of sedentary lifestyle, so we should be spending some time for ourselves, for us to have regular exercise. We should stop smoking. That's an absolute must. And of course, alcohol is also is one of the factors, and we should stop that. Now, diabetes and hypertension. These are the two treatable and preventable causes of the stroke. So diabetes has to be screened for the aged patients especially. It should be treated properly. And hypertension, high blood pressure. So these are the few things. And as far as our food habit is concerned, we should be avoiding too much oily food, junk food, and regular exercise. So this will be our tips for preventing this stroke.
Okay. Now, doctor, what are the treatment options for brain stroke or strokes that we are talking about?
Yeah. So when a patient is coming to our emergency with signs and symptoms of stroke, the first thing that we have to evaluate him with clinically. So there are a few things we look at, like as I've mentioned already in the signs and symptoms. And we should first do a CT scan. So this is an absolute must that the patient should be going to a hospital where there is a facility of having 24 hours of CT scan or an MR scan. And if the neurologist is there and the stroke team is working at that particular hospital, so that's an absolute must. And when the patient comes, we do a CT scan. We exclude some of the mimics of the stroke. Okay, so that is very important, and we understand that the patient is having stroke, and then the treatment starts. Okay, and those the investigation and the clinical evaluation should not take much time, because we should not waste much time. And once we find that the patient is having stroke, that is ischemic stroke, okay, we tend to give an injection called TPA, tissue plasminogen activator, and that should be given within 4.5 hours of stroke. Okay, so that's a time-bound treatment. If the patient comes beyond that time, we can't give that treatment. Okay, at least for now. So 4.5 hours is very much important, but somebody should be remembering that he should not waste that much time. Okay, so he should be coming immediately. So that is one of the medical management of stroke. Now, a few of the trials are published, recently, not recently, in recent past, so which allowed us to treat the acute stroke patients even up to 24 hours. Okay, so that is very important. So once this 4.5 hours time window passes off, we have a huge opportunity, and even within this time also, we can take the blood clot out of the blood vessel by a process called neurointervention. And how we do that? We put a stent inside the artery and suck and extract the clot out. We also can suck the clot out with a large bore catheter, that is the plastic tube, in a simplified manner. And that is done in a area called catheterization laboratory, or cath lab, where we and the cardiologist also work. So this is how the clot is taken out from the artery. So the basic goal is to lyse the clot or to take the clot out so that the blood circulation is established in the brain as soon as possible. So within 4.5 hours, we start with the tissue plasminogen activator injection. But our CT scan and the CT angio tells us how big the clot is and where the clot is situated. So if the clot is situated in a major artery, we do not wait for the TPA to work. We immediately take the patient to cath lab and either extract the clot or suck the clot out to immediately restore the blood supply to the brain. So these are the basic two basic treatment of acute stroke.
Doctor, my next question, which I have for you, is why is there so much discussion about time when we talk about stroke?
Yes, that's what I already also mentioned, because time is the essence for the treatment of acute stroke. Why is? Because each passing minute when the patient is not treated,
Yes.
around 2 million brain cells are dying. And the brain, as I have already mentioned, is an amazing structure because when for each of our work, a particular area of the brain is assigned. So a small area of the brain can get affected, but we might not be speaking at all, or we might not be able to move our right hand at all. So this is a huge deficit. That's why the small area of the brain is affected. So brain has got its work which is assigned to a particular area, and with each passing time, a lot of neurons die. That is, the brain cells die. So we should not waste any time. So that's why time is so important when we talk about the treatment of acute stroke.
Okay. Now, doctor, the recent report says that COVID-19 patient has even higher risk of stroke. Is that true? I mean, if you could explain that.
Yes, because there has been a lot of studies which are being published in New England Journal of Medicine, Lancet, quite recently, and that shows that around 0.9 to a little bit higher percentage of acute stroke related to COVID, because the COVID has got a tendency for clotting, clot formation inside the artery, and that is the same mechanism with which the acute stroke happens. So obviously, we are seeing a higher percentage of acute stroke in COVID patients. So that's a matter of concern. So that's why it is also very important for all the doctors who are treating COVID patients to be aware of this fact, to recognize the early symptoms of stroke in those patients, and to treat them accordingly. Otherwise, if we do not treat those patients, 8 out of 10 patients will be left with deficit, and that's a huge burden for the society and for their family. For their families.
Well, doctor, thank you so very much for talking to us and giving us such wonderful insights. Actually, it was really very helpful for all of us. Thank you so much.
Thank you. It was my pleasure. Thank you so much.
So that was Dr. Sukalyan Purkayastha, head neurointervention and endovascular surgery at Institute of Neurosciences, Kolkata. And I'm sure that, Doctor, your words of wisdom and experienced medical advice will help us and our listeners a lot. Let's be sure to remember the health tips and practice them. Prioritize our health above all. And this stroke day, let's promise to take care of ourselves and the ones around us. And for the entertainment, definitely, we are there. For the sake of entertainment, we are there because Fever 104 FM is there. So stay hooked to Fever FM. And doctor, once again, on behalf of Fever FM, thank you so very much for sharing your words and time with us.
Thank you very much. Thank you.